How long do Kegel exercises take to show results? If you're wondering how long it takes to notice improvements from doing Kegel exercises, the answer generally falls between 6 to 8 weeks of consistent practice. These exercises target the pelvic floor muscles, which support the bladder, uterus, and rectum. Strengthening these muscles can help reduce urinary leakage, improve bladder control, and support overall pelvic health. Some people might start to see small changes within a few weeks, such as less urinary leakage or a feeling of better muscle tone. However, for the best and most noticeable results, it usually takes about 6 to 8 weeks of regular, correct exercises. The time frame depends on how weak the muscles are to begin with, how often you do the exercises, and whether you are using proper technique. Research shows that most people need to practice pelvic floor exercises for at least 8 weeks to see meaningful improvements. Working with a healthcare professional can help ensure you are contracting the right muscles and doing the exercises correctly. About 30% of women initially find it tricky to identify or contract the right muscles without guidance, so professional instruction can make a big difference. Clinical studies have observed improvements in pelvic floor strength and bladder symptoms after around 3 months of dedicated training. Some benefits may continue to develop up to 6 months or longer with ongoing practice. For individuals with bladder health concerns or those recovering from bladder cancer treatments, Kegel exercises can be a helpful, non-invasive way to support pelvic muscle strength and manage symptoms. But it's always best to consult a healthcare provider for personalized advice, especially if you have medical conditions affecting your bladder or pelvic area. To get the most out of Kegel exercises, perform them daily. Start with a manageable number of repetitions and gradually increase as your muscles get stronger. Focus on correctly contracting the pelvic muscles without using your abdominal, buttock, or thigh muscles. If you're unsure about your technique or if symptoms don't improve, seek guidance from a healthcare professional. Remember, Kegel exercises are part of a broader approach to bladder health and should complement any medical treatments you may be undergoing. In summary, consistent practice over about 6 to 8 weeks is typically needed to see real improvements in pelvic floor strength and bladder control. This time frame is supported by scientific studies and expert guidelines. Keep in mind that individual results can vary, and patience and proper technique are key. Always talk to your healthcare provider for tailored advice and to ensure you're doing the exercises safely and effectively.